So today's program is Medicare 101. And with me today, I have Mr. Simon Manrique from the Area Agency on Aging of North Central Texas. So we look forward to a very informative session. And yes, once again, if you do have a question, whether in person or those of you who are joining us virtually, please use that chat session. With us today, we also have Melinda Gardner, who will be assisting with that chat. At this time, I'm going to hand the screen over to Mr. Simon Manrique.
There it is. Fantastic. Right. Well, good morning, rather, everyone. Thank you for those of you that are here with us. Thanks for coming in today. Appreciate y'all being here, and those of you that are online virtually, also thank you for attending. And again, my name is Simon Manrique. I am with the Area Agency on Aging, and we are also part of the CHIP program, which is the State Health Insurance Assistance Program. And we get a lot of individuals that are either called Medicare, Social Security, Medicaid, and then eventually somehow they get referred to us, because a lot of times it's the questions that come across to Medicare, to Social Security, to Medicaid, and they wind up with us. Now, I am a benefits counselor. I deal mainly with Medicare, but we are also trained to help individuals with Medicaid applications, whether it's SNAP, the Medicare savings programs, which I'll get into a little bit more. And there's even a program that's called Extra Help. And with Extra Help, it helps individuals with their prescription medications, okay? And again, my name is Simon. I'm glad to be here today and to be able to give you this information that's going to be very, very helpful to you. Just so you know, again, like I was saying, we're part of the CHIP, which is the State Health Insurance Assistance Program, and we are federally funded, okay? And the slides will be available to you online also, okay? And a lot of individuals that are with the state health insurance information, we help individuals to understand the cost and the coverage of Medicare. We help individuals compare options that are available to you through Medicare. We help you to enroll or change plans. Sometimes individuals are coming in and they're coming in on original Medicare with the standalone prescription drug plan, which is pretty normal. And then we have other individuals that come in and they're enrolled into a Medicare Advantage plan usually it's with prescription drug coverage. Medicare has subcontracted with several private and commercial insurances, and too many to name, but there's a whole bunch of them on there. But Medicare has subcontracted with them, and you call these insurance companies and they will tell you what plans are available in your particular area. Dallas is an area, Fort Worth is, or Tarrant County is a different area. This is Collin County here, correct? I believe Plano in Collin County. Yeah, different. Some of the plans have the same name, but there are different plans for each area. Just to give you an idea, a snapshot of CHIP, there are 54 CHIP programs across the United. Every state has it. 2,200 local programs are available. There's 12,500 counselors available through the CHIP program. We've helped individuals, about 4 million, over 4 million individuals are educated by us, and there's 2.5 million counseling sessions that happen throughout the year. Do you have free time? A lot of individuals at this point do have a little bit of free time, and if you do have the free time, CHIP looks for volunteers, and you can become a volunteer to help individuals. How many times have you needed information and you didn't know who to call, where to call, what to do? Well, through the CHIP program, you can be that person that these individuals can call to get the help that they need. The information, you cannot imagine how many times we've gotten calls and individuals are like, hey, I'm turning 65 next month. I don't know what to do. I don't know north, south, east, west, right, left, up, down. I have no idea. And I've been inundated with so much information. That's what a CHIP counselor can do, can help these individuals like you, like me, that need this additional information to be able to make the right choices that will work for us according to our conditions or whatever we have, our situation, financial, anything, all that kind of help is available through the CHIP program also, okay?
I have a question. What do the initials SHIP stand for?
State Health Insurance Assistance Program, which is right there.
Oh, well, it was so little, I didn't see it.
I'm sorry about that. Yeah, that's okay. That's all right. And here is the phone number that you can call, or the website that you can call, to go to get information about the CHIP programs that are available to you and how you can possibly even help. Medicare Renew booklet. This is a picture, the front page, the cover of the Medicare Renew booklet for 2024. Very, 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 very informative. There's also a website that you can go to get this information. That website is medicare.gov. Is a website that you can go to get the information. At the website, at the medicare.gov website, it'll allow you to enter the zip code that you're in. And if that zip code pertains to 2 or more counties, you'll be able to select the county that you're in, and then it will tell you again directly. It'll show what plans are available in your area. The Medicare.gov website also allows you to enter the medications that you're taking. It'll ask for the name, the dosage amount that you're taking, the how often you take it. Then, according to that information that you have, plus the pharmacies, it also allows you to pick the pharmacy that you use to get your medications. Now, you want to look for a preferred pharmacy, because with the preferred pharmacy, you pay less for your medications, and the insurance company helps you even more on the cost of these medications, okay? And that's the Medicare.gov website. Once you enter that information, the program itself is going to show you the least expensive plan available to you according to the cost of your medications that you're taking, the pharmacy that you're at. It'll show you that information, so it gives you good detailed information that you need to help you make the choice of the plan that best works for you according to the medications that you're taking and where you live. Now, here's some new information. Yes, sir.
If I log into the Medicare.gov, will it show also a special needs program?
And the what?
SNIP, SNP.
SNP.
SNP. Yeah, a friend of mine told me that he has diabetes. So
Yes.
He also has Medicare, but Medicare has a special program called SNP.
Okay, I've heard of SNP, but I've never heard of the SNP. I've never heard of
I
that
don't
yet.
know if that information can be
Yeah.
from the website.
But again, you can go to the Medicare.gov website, or you can even go to the Medicare.org, and it gives you the information that you need, anything and everything, or even better, you can call us. At the end of the program, I'm gonna give you our phone number.
Mhm.
I'll give you my direct extension,
Okay.
and you can reach out to me, and I will be more than glad to help you. We're there at the office, so we are available from 8 AM to 5 PM, Monday through Friday. And again, whatever information you need, we can help you. We can direct you to what options are available to you that you can use. With the Medicare, again, this website here, it's indicating, or not the website, but this is from the Medicare and new 2024 booklet. It says, what's new and important? Medicare strives to improve access to affordable treatments to keep you healthy. Check out what's new this year to help you manage your benefits. Saving money on your prescription drugs. If you haven't heard anything on that, you need to look up into that also, because there's been some nice changes, real good changes, as a matter of fact, to help you get your medication.
Melinda has also shared that SNP is special needs plans, advantage plans available for people who have special needs, chronic conditions.
S&P, yeah, okay, yeah, I know it is S&P, yeah, there's a special need plan. those special need plans work when you are on original Medicare and you're on Medicaid. And then they're usually called dual because it's Medicare and Medicaid. So the dual plans and the S&P, the special needs plans. And so you have to have be qualified for Medicaid also, usually to be able to take advantage of those particular plans. And yes, the Medicare.gov website does show you the special need plans that are available in your area also. So it's good. And usually with those S&P plans or the special needs plans, you know, whatever Medicare doesn't pay, Medicaid picks up, and that's how those particular plans work. They're really good. They're really good. And again, things that are new, there's a lower cost for insulin and vaccines. With the insulin, 30, oh my God, yeah, $35 a month for insulin. Where I know some individuals with certain insulin, depending on the companies that they were with, they were paying anywhere from $100 to $200 for their insulin. But now it's set. It's $35 for a 30-day supply of insulin. Whether you get 1 month, it's 35. If you get 3 months, because there's a lot of individuals that don't have that mobility to be able to get around, so they get 3 months at a time. 35, 35, 35. And that's what you're going to pay for it. Also, as you can see, there are changes to telehealth coverage. A lot of individuals don't know that they have this coverage for telehealth where you can call your doctor and talk to your doctor over the phone instead of going to the office and being susceptible to any kind of virus that might be there. You know, God forbid that it happens, but it has happened. Individuals are talking about it. So a lot of individuals are taking advantage of this telehealth program when you can just call your doctor over the phone. And you know, nowadays with your phone, you have the cameras on your phone, so the doctor can see you to get an idea of how you're talking to him, how you're reacting on your face and all that. So the doctors do see that. And the only reason I know that is because just recently I had a telehealth appointment with one of my doctors, and he said, I need to see you. And I was like, okay, well, here I am. He says, okay, now I got an idea better of your expressions, what's going on, what's not going on. So yeah. Also, some of those managing and treating chronic pain. A lot of individuals, you got to manage the medications that you're taking. You got to manage care situations. There's better mental health also care. So there's been some openings as far as or widening mental health care that's out there for individuals. And then, of course, Medicare is giving, there's been some changes with the time that you have to enroll into some of these plans. Like during open enrollment, which is from October through December, open enrollment every year, it's the same. You can enroll into a Medicare Advantage plan with prescription drug coverage, or you can stay on original Medicare with the standalone prescription drug plan. If you enroll into a Medicare Advantage plan with the prescription drug coverage, there's a period from January the 1st through March the 31st that you can change to another Medicare Advantage plan, or if you're already in a Medicare Advantage plan, you can go back to original Medicare. And that's something that's new that just became available a couple of years ago. So it's a neat option for individuals to be able to do that. You can go back to original Medicare or switch to another Medicare.
What's the difference between the original?
I'll get into that here in just a minute. I'll give you that. Okay, COVID-19 care. Also, they're being a little bit more into that to where you can get COVID-19 care. There's a lot of COVID-19 information out there that they are putting it out there, because even right now I am still hearing individuals that, hey, I had COVID last month. I'm like, but still, unbelievable. But and they said, I've gotten all the injections and everything, the vaccines and boosters and all that, and I still got it. An individual I was talking to the other day, he had three shots that you were supposed to take, and he still got it again. But he said it wasn't as bad. So they're saying that was attributed to the vaccines, the injections that he had gotten before. That's why he didn't get it as bad as he might have. So those are some of the new and important issues. Here we go. What is the parts of Medicare? Medicare consists of, 4 parts that are identified. There is Part A, which, covers your hospital services. There's Part B that covers your doctors and their services. And then with that, A and B is usually referred to as original Medicare, Part A and Part B. That's original Medicare. Now, if you are in original Medicare, then you have to enroll into a standalone prescription drug coverage. Okay? And again, Medicare has subcontracted with several private and commercial insurances that you can call. And again, you're going to give them the list of your medications, the name, the dosage amount that you're taking, how often you're taking it. And then they will tell you again, this program, this plan is available in your particular area. This is how much you're going to pay for your medications. And you can call us again. We can help you with that. Or if you're computer savvy enough, you can go to the website, the Medicare.gov website, and everything is there. So, Part A, Part B, and then for your drug coverage is Part D, as in drugs. Always individuals sometimes don't understand. If I'm saying Part D, B, or E, and I'm telling them Part D for drugs, makes it easier to understand what's available to them. A lot of individuals call, I'm signing into Medicare. What are my options? Just like I was talking about. On the left-hand side, you'll see what it's like, what's available to you, what you have as far as original Medicare. Original Medicare consists, again, Part A, Part B, and then the Part D for drugs is separate. That's separate from the original Medicare. You're gonna have to call a standalone prescription drug plan, and that's all it's gonna cover, just your medications. You call them, you enroll. Same thing, again, you're gonna give them your medication information, and they'll tell you how much you're gonna pay. That is one way of getting coverage. Original Medicare, Part A, Part B, Part D, and then if you can't afford it, at the bottom of the screen on the left-hand side, you'll see that it says supplemental coverage. These supplemental plans, what they do, they cover usually what Medicare doesn't cover. These supplemental plans, they're identified by letters because they're come across as what's called the Medigap policies, and the policies are identified as letters A, B, C, D. If you're old enough, F may be available to you. F as in Frank. F has also a high deductible plan policy available. And then there's G as in George, regular G, and then there's G with a high deductible, and then KLMN. The predominant one was plan policy F, because policy F covered everything. If you went to the doctor, it covered your copays, it covered your deductibles, it covered your co-insurance, everything. You almost didn't have to pay anything. Now, one thing about these Medigap supplement plans, doesn't cover your prescriptions, okay? Has nothing to do with it. This is only for medical coverage, in particularly with Part A and Part B. That's what the supplemental or Medigap policies cover. Let me get to this. The predominant one nowadays, a lot of individuals are going with G is one of the predominant ones that they go with, because what happened a few years ago, a couple of, like maybe 3 years ago, 4 years ago at the most, Medicare did away with Plan F, meaning anybody coming in about 3 years ago into Medicare, if anybody new, as a matter of fact, anybody right now anybody new coming into the Medigap policy, they will not offer you Plan F, which again covered everything, your copays, deductibles, co-insurance, both A and B. So F is not available, but a lot of individuals are switching over to policy G, because G basically does the same thing that F does. The only thing that F doesn't do, it doesn't pay the Part B annual deductible, which I believe this year's $264 is what you're going to be responsible. But anything after that, Plan G, policy G, gets it. Now, there's something also with these supplemental plans. Within policy G, depending on where you live, where your zip code, there's anywhere 50 to 60 different plans that are available to you. And the way it works, plan number one is gonna be the least expensive one. When you're coming into Medicare, you're looking at about, just an estimate. It's about $100 a month to have a supplement plan. In plan G, in G. The most expensive one, number 50, number 60, depending, you're looking at about $450 a month. But there's a catch here with these Medigap supplement plans. Whether you pay $100, which is gonna be plan number one, or whether you pay $450 with plan 50, the coverage is identical. There's no difference.
So what reason to pay more? What reason to pay more?
Because they can.
Okay.
It's. I'll get into it a little bit, but again, that is the luxury. They tell you which one's the least expensive and which one's the most expensive, or if you want something in between. So the coverage is identical, doesn't matter which one you go with, but the cost. So you're gonna look at the cost is different, they're not all gonna be the same, and then, of course, the name. And some of the names are different. Yes, you're gonna see the United Healthcare, you're gonna see the Blue Cross Blue Shield, Cigna, Aetna, Humana, but then there's a couple of other companies. There's a Mutual of Omaha, there's some of these are called life insurance, casualty, and all this. Those are the names of the companies. But again, they're subcontracted through Medicare, and they're able to sell you a plan of coverage, okay? Now, as you get older, a lot of individuals ask me this, what's gonna be the cost? How much it's gonna cost me in a couple of years, 3 years? We get older, right? From year to year to year, our age goes up. Well, guess what? With these plans, the same thing. The monthly premium goes up. Sometimes it stays the same for 2, maybe 3 years at the most once you come in, but eventually it's gonna go up, and that's only because of your age. I've had individuals call and they're 70 years old, already 5 years after 65, and they finally heard about the Medigap policies, and they're like, I want to take advantage of this. Okay, but you're 70, so now you need to be prepared. It's gonna be a little bit more expensive than normal because you're already a few years. And another thing, that you're susceptible because you're 70, because you're 75, because you're 80, you're susceptible to what they call underwriting. And through underwriting, you give them permission to look at your medical records, and they get a copy of your medical records, give it to someone, sit them in a little room and have them look at all your medical records, and they're looking for keywords: cancer, diabetes, neuropathy, those kind, big words that are you may have. And as they find those keywords, the cost is going to go up. And again, it's up to them. They're going to tell you, this is how much you're going to pay on a monthly basis, because you're already older. This is how much you're going to pay, and then it's up to you. Do you accept it, or it's even an option to them? They can decline you and say, no, you've got some conditions that we'd rather not, and we won't. So then you're going to have to do some shopping. We can help you with that. We can also help you with that to get the necessary information for that.
What determines the original
Medicare?
falling under the original Medicare?
It's options that the government is giving you. You either can go with original Medicare, A and B, and a standalone prescription drug plan, or you can go with the Medicare Advantage plan with prescription drug
So
coverage.
regardless of your age, what you're saying.
Yeah, because some people
So
work, some
mostly-
people work, and they have coverage. They're up until they're 70, 72. And at 72, they finally decide, okay, I'm gonna retire and I'm gonna take advantage of my Social Security. So usually what happens at 65, if you worked at least 10 years of your life and you accumulated the 40 necessary credits through Medicare to get Part A free, if you have the 40 necessary credits, and usually the way they do that, Social Security is gonna determine that. Well, and they will know how many credits you have, whether you have 40, 39. If you have less than 40 credits, you're gonna pay more.
So basically, the term, back to the question, basically the term original just means prior to Medigap and all this other stuff being.
No, original Medicare is Part A, consists of Part A and Part B,
Right, I understand.
okay?
That was the original. So the term original just applies to the wording on Medicare A and B.
Correct.
Anything after that doesn't fall under what you're calling original. I'm just trying to get clarification on
No.
what you're saying.
Yeah, I understand. No, yeah. I get, a lot of times it's terminology, because
Right.
I've been doing this for a little while, so I have a certain terminology that's in there, and then, and it happens all the time. I get calls and individuals call, I have a supplement. Okay, so to me, a supplement is a Medigap policy, A, B, C, D,
Right.
E, F, G, or, and then they tell me, I have a supplement. It's a Medicare HMO plan.
Right.
I'm like, okay, that's not a supplement. That's a Medicare Advantage plan.
Right.
With or without prescription drug coverage. And usually more than often, the individuals are going to try and get you to go with the Medicare Advantage plan with prescription drug coverage, okay? So,
Question.
And let me just add to that on the red, white, and blue card, your Medicare card, it will only have Part A and Part B. That's all it will ever have on it, because that is original Medicare,
original Medicare, right, the red, white, and blue card, right?
and sometimes called traditional Medicare.
Mhm.
Gotcha.
Yes, Mike,
Thank you, Simon.
Supplement.
What's that?
I got a question about the supplement.
Go ahead.
Medicare. You just told us that Medicare was supplement.
Yes.
Is for there, just in case Medicare denies certain treatment, it covers the gap. But I found there are a couple of cases that I was denied.
Yeah.
So the other day I went to Sam's Club Pharmacy
Mhm.
to get COVID-19 vaccine. I
Mhm.
was denied. The reason was, starting this year, government doesn't pay for COVID-19 vaccine for free. So why Medicare was supplement denies it too?
Yeah, because you got to remember, the Medigap supplement plan only covers what Medicare doesn't cover. So if Medicare didn't cover it, or not paying anything for it, don't expect the Medigap policy to cover any portion of it also. Because remember, Medicare pays 80% of whatever. If you go to the hospital, you go to the doctor, Medicare pays 80%. You are responsible for 20%. That's usually what the Medigap supplement plan covers. So the Medigap supplement plan is not gonna be the primary payer. It's always gonna be Medicare. As a matter of fact, the only way you can take advantage of the Medigap policy is by enrolling into original Medicare and a standalone prescription drug plan is the only way that you can take advantage of the Medigap supplement plans. If you go with a Medicare Advantage plan and a broker or agent calls you and wants to sell you a Medigap supplement plan, you're getting ripped off. They're not supposed to do that. But again, with I'm sorry to say it, insurance companies, hospitals, clinics, doctors and everything. First and foremost, this is my own personal opinion. I'm gonna say it. A lot of times they're in it for the money first. What is it when you go to the doctor, when you go to the hospital, one of the things they first ask, insurance, do you have insurance? Because they want to get paid for whatever service, because they are a business, they are about, yes, they care about you. Yes, they want to treat you, they want to get you good and everything, go home and live a better life and everything. But again, first and foremost, they are a business. And again, the government is just giving you options. That's like when you go into the Medicare.gov website and you look at the names of the different companies that are available, the plans that are available to you. They're going to list the least expensive plans that are available to you that cover the most as far as your medications, but you have to look and see what kind of a deductible you're going to pay, what kind of copays am I going to pay. There's HMOs and PPOs, and you have to look at those. We can help you with that information.
One more point.
Sure.
One other thing, and I'm not sure what happened to the PowerPoint. It's not showing, but one other thing I wanted to mention, someone in the room talked about the COVID vaccine not being covered. Medicare will cover it if it's at a doctor's office. I think what the information that we receive is it will no longer be covered like at the pharmacies, but it will be covered in a medical setting, so in a doctor's office, and that maybe because if there's any reactions or anything, I'm not sure why they did make that change, but yes, that is effective now. So
You said you went to Sam's, right? Sam's, yeah, he went to Sam's.
yeah,
So it was in a like a
Right there
pharmacy.
with my wife. She got.
right. So that's what I'm saying. It's only in a doctor's
Mhm.
Yes,
office
that is-
setting.
So why I was discriminated while my wife was accepted. So
She's-
Medicare is not fair.
She's free kid.
Oh, maybe.
Yeah, Simon, we still have quite a few slides to go through, so
Yeah.
I would suggest going through
Right.
and then getting the questions at the end.
Yes, ma'am.
Thank you.
Thank you. So a big part right now, because it's the beginning of the year still, even though we're in February, but still, preventative services is a big thing that individuals need to take advantage of. Because again, with the preventative services, they're looking to see, are you okay? And if you're not, let's do something. And that's what this does. And then just to give you an idea of some of the services that are available to you that through Medicare and through your Medicare Advantage plans. Again, the objective of this presentation that I'm probably getting to again was the Medicare parts and options that I just finished talking to, which preventative services are covered, who is eligible to receive them, when preventative services are covered and how much you may pay, and where to get more information. That's going to be us. We're going to help you with the information that you can get. Again, the Medicare options I went through, I'm going to go through the Medicare preventative services, and then also kind of give you an idea of what the Medicare Part B, when you go to the doctor services, which is also a lot of individuals refer to Part B as medical insurance, okay? Paying for preventative services in 2024. Assignments is an agreement by your particular doctor, your provider, or supplier to be paid directly by Medicare to accept the Medicare approved amount as full payment for covered services and not to bill you for any more than the Medicare deductible and the co-insurance. Individuals have called and said, hey, I'm getting billed, even though Medicare already paid and this doctor is charging me more for the services. And he's like, well, from what I understand. Yeah, okay, so then we let them know what you can do to kind of so you don't have to deal with that, okay? Maybe I should have gone back. Let me see. Okay. In original Medicare, you pay nothing for most preventative services. When Medicare pays 100% of the approved amount, as it does with most preventative services, usually you don't have to pay anything for the preventative services. So you need to make sure that the doctor's office, not because it's not going to be done by the doctor, but the doctor's office does the coding for the preventative services. Coding plays a big part. A lot of individuals, that's where sometimes you get charged extra because of the coding that's done. It's not coded as a preventative services. So you need to make sure that the doctor's office is coding it as preventative services, okay? If you have a Medicare Advantage plan with any one of these private companies, your plan cannot charge you for preventative care services that are free for people with original Medicare. And a big term to remember is if original Medicare pays for it, the Medicare Advantage plan should also pay for it with whichever particular insurance you're with. What's covered? As far as through original Medicare and the Medicare Advantage plans, what's covered? Just here's a huge list of preventative services that are available to you. There's the Welcome to Medicare when you're first coming into Medicare, the yearly wellness visits. I don't know how many of you take advantage of these wellness visits, but if you don't, you do need to take advantage of this. Again, it's because it's for your health concerns, okay, to get you to abdominal, aortic aneurysm screenings, alcohol misuse screenings. Unfortunately, that's something that's out there. Bone mass measurements, cardiovascular disease screening, very, very, very important. Glaucoma test, hepatitis B shots, vaccines, you know, that's all that's covered. HIV screening, I don't think there's too much of that nowadays, but still it is lung cancer, mammograms for women, very, very, very important. Obesity screening, men, prostate cancer screenings. And then they also help you with the last one, which is the tobacco use cessation counseling. They offer you counseling to try and help you to stop using tobacco in any form, whether it's what we know as the chew or you're smoking. They help you with that. Okay, so here is part of what the welcome to Medicare visit. They will review your medical and social history. They'll review of the potential for depression and other mental health conditions. They will help you by reviewing your ability to function safely in the home and community. A lot of individuals get to that point to where they can't walk around too well. And okay, so do you need a cane? Do you need a walker? You know, what do you need? What you may need to help you to get around, to be mobile around your home. I mean, it's crazy because I know we've heard stories about individuals that are just stuck in one room because when you can't be, you know, the hallways that they have or the way they navigate to get out of the room to the kitchen, to the living room, it's hard for them. So to avoid all that and it being, you know, avoiding the stress of trying to move around, they just stay in the room. And even then, sometimes to stay in the room, yeah, it's their comfort zone, but at the same time, they want to be able to get out. They want to do so. Very, very important. They check your height, your weight, your blood pressure, body mass, and vision. Because you know, as we get older, our vision. Then they also offer there's education, counseling, and control related to your risk factors. Again, are you able to get around? Are you not able to get around? Are you able to see? Are you able to eat? Not eat? And again, there's education, counseling, and referrals related to other preventative service covered by Medicare, and this can include a schedule or checklist based on your health needs. Annual visits. The annual visits, Medicare covers yearly appointments for those enrolled into Part B. And so with these annual visits, they look at how you're progressing from last year to this year. They update your list of current medical providers and suppliers. Again, if you have a DME, durable medical equipment, wheelchairs, walkers, the canes, all that plays a big part. Provide health advice and referrals to health education or providing counseling services and or programs. They look at all that. All that's available to you. A lot of individuals don't know, and because they just go to the doctor and they just I can't tell you how many times I've heard stories. I went to the doctor, he looked at me, and that's about all he did. You know, took my blood. The lady before took my blood pressure, checked my heart, checked to listen to my lungs. I went in the doctor saw me, the doctor saw what the nurse had done for me. Oh, you're good. Okay, no. There's services that are available to you. Very important. Go to if you don't have a Medicare and you book, we have booked a lot of times you can call us. I can send you one. I'll mail you one with even some additional information that's also available through that. Okay, so very important. Wellness visits you need to have. Here's some information about abdominal aortic aneurysm screening. There's a lot of information there, and I'm going to leave that available because of the timing issue. But anyway, this is one of the screenings that is available to you. Very, very, very important also to help you get through. Alcohol misuse screening and counseling, like I was talking about. Some individuals just alcohol, like they say, helps them forget, but they only forget for a little bit. That doesn't solve the problem. That doesn't make the problem go away. Whatever situation you have, whatever diagnosis you have, whatever, you know, the illness you may have, alcohol doesn't necessarily take it away. Like I said, you may forget for a little bit, but it's still going to be there. Okay, so know that the counseling is available to you to help you, and screening also to see where you're at. Breast cancer screening, very, very, very important for women nowadays. So many stories that we have. This is covered for all women with Medicare. One baseline mammogram between the ages of 35 and 39, once a year starting at 40. And then again, no cost if the provider accepts the assigned amount through Medicare. So you need to find doctors, specialists. Make sure when I call my doctor and they tell me, hey, I want you to try and get a stress test. Okay, just make sure wherever you're sending me, that doctor that you're sending me does accept my insurance. That you need to double check. Don't leave it to chance, because if you do, all of a sudden they see someone that doesn't accept Medicare or whatever plan you're on, the Medicare Advantage plan. So very, very important. Okay. Bone mass measurements, x-rays are involved here. And then a slew of I know the osteoporosis is very big with these bone mass to see where you're at. So also bone mass measurement is important. Cardiovascular disease screening. They do the blood test for early risk detection. Went to the hospital here not too long ago. I was feeling kind of crazy, and yeah, they did the blood test, and they did the MRI, and they did a couple of other tests to make sure as where I was. And guess what? I'm good. So it was a good outcome for me, but still very, very important as far as cardiovascular disease. Actually, they were checking to see if I'd had a stroke, and so very important. Behavioral therapy. They help you with the behavioral therapy. They provided by a primary care provider in a primary care setting. If you notice there, it doesn't say a specialist. It says your primary care doctor. It's something that, again, your primary care doctor can do. Encourage aspirin use. It benefits overweight. Aspirin, a lot of individuals that I've been talking to lately, where they're giving me the list of their medications, they talk about the low dose aspirin that they're taking. So it's available. If you go to the pharmacy, you can ask them for low dose aspirin. They'll tell you exactly where it's at, what it is, and you can obtain that. And usually I know because I'm on it, one little pill a day is all you need for the low dose. Okay. Cervical and vaginal cancer screening. Women, very, very, very important. The PAP test, pelvic exams with clinical breast exam. The PEP test helps find cervical and vaginal cancer. Screening pelvic exam helps find the fibrosis and ovarian cancers. I can't tell you how many individuals I've heard with these situations. So again, very important test screenings that you have access to. This is a continuation. It's covered for all women once every 24 months or once every 12 months if you're either a high risk or childbearing age. Okay, so individuals in that situation. Part B also covers the human for, I can't say that word.
HPV.
Yeah, the HPV. There you go. Test that's part of the PAP test, and that's also available to you once every 5 years. So if you're not an individual that writes things down, these are some of the things you need to write down as far as to keep track for yourself. Again, Medicare and your insurance companies want you to be healthy, so take advantage of the services that they offer that are covered for you. Colorectal cancer screenings helps to prevent or find cancer early, helps to find precancerous growths. And then one or more of the following tests may be covered. The screening, the fecal occult blood testing, the screening flexible sigmoidoscopy, and the screening colonoscopy. That's one that a lot of individuals that I spoke to that doctors refer them to get that colonoscopy. And then colorectal cancer covered screenings. This is a listing of when the tests are available or how often they are available to you that you can take, and then it even indicates how much you pay. For a lot of these are, which is no cost to you. Again, these are preventative services that are available to you at no cost to you. You just,
So every year.
yep, 12 months, and then as you go a little bit more, you'll see the 4 months, 10 years. And for some of the, like the colorectal, the colonoscopy. And again, these slides will be available to you online, so you can go to it because this is being recorded, so it will be available to you. There's some additional information as far as the colorectal cancer screenings. Prostate, big on men as far as prostate. I used to be an EMT. Part of the training to become an EMT was to do hours in the emergency room setting. So you had to, this is one of the things that they talked about as far as issues with prostate and how it can affect all men. All men are at risk of prostate cancer. So men, if you're not familiar with the prostate cancer screening, talk to your doctor. They will help you. Lung cancer, secondhand smoke. And of course, if you actually smoke, if you're tobacco use, be careful with this. And again, individuals that don't necessarily smoke, but are around the secondhand smoke, guess what? You're susceptible to this. So you need to be careful with this, okay? Depression screening. I don't know what I'm gonna do. I don't know how I'm gonna do this. I don't know how I'm gonna do that. How should I do this? How should I do depression? It has a lot to do with the way we think, the way we see things, the way we want things done, and then when it doesn't quite work out the way we want, depression. We get down on ourselves, and because we're not able to get what we need, get what we want, and just something you need to be very careful with. You need to talk to your doctor. If you talk to your doctors about this, they will help you, and there is help out there a lot. Some counties have more help than others, but a lot of counties I know Collin County is one of the better counties that I know that they offer a lot of assistance for elderly individuals that are dealing with depression and getting individuals to the help that they need. Diabetes. I hate to say it, diabetic. To begin with, at first, I started feeling good. I guess I don't need to take my medication or do my injection for tomorrow because I got a good reading on my glucometer today. So I'm not going to take it. I was one of those that kind of started looking at things that way. And guess what? I wound up in the hospital again. And, my blood sugar was at like a 200 and something. Shocked the heck out of me. My A1C was like at, I think it was like 12 something. Doctor said, you got to make a change. If you don't make a change, there's going to be a change that you're not going to want that's going to happen to you. So you need to take care of yourself. Take your medication accordingly. And I had an individual, I've heard an individual that was telling me the other day, I saw that he was eating a couple of pieces of cake, and I said, dude, you need to be careful with that. He says, no, I'll just take an extra injection at the end of the day. Not about that. So you need to take it the way it's prescribed for you to take. And again, the screenings are very easy. You go to the doctor. The doctor's gonna either send you to a lab, or if the doctor has a lab there in their building that they continue to boom within. It doesn't take them long to find out where your diabetes is. So check your blood sugars if you're not familiar with that. Okay. Flu shot vaccines, influenza, also known as the flu. Medicare tradition covers the flu shot once every flu season. Yeah, every year. The flu, there's different, the pneumonia shot, the hepatitis, when I go to the doctor reminds me, hey, see you, it's time for you to get your shots. I feel like a little pet when they tell me that. I gotta get my shots. Okay, yeah, give them to me. Give me whatever I need. So, because I want to be good and I don't want to be having a good time with having a bad time with any of these conditions. Glaucoma test. Usually with the glaucoma test, you go to a doctor, the eye doctors are the one. Look for doctors that accept Medicare. Or if you're on a Medicare Advantage plan, look for a doctor that accepts your particular plan and covers this. So this is very important. Our vision is very, very important. Just here in this room, there's 2, 4, 6, 8 of us, and out of the 8 of us, 1, 2, 3, 4, 5, 6 of us are wearing glasses. I wonder why.
To see an eye
Yeah.
doctor, do you need a referral from your PCP?
No,
No,
No.
you can go ahead and.
Right.
see.
just find a doctor that accepts your particular plan, whatever coverage you have. But no, you don't need to get a referral from your primary care doctor on this one. Hepatitis B shot. The hepatitis is a serious disease. The virus attacks your liver. Drinks, be careful with that, okay? Because like it says there, it can cause lifelong infection resulting in cirrhosis or scarring of the liver cancer, liver failure, and eventually death. So this is one that you also want to have checked out because again, very important, it can hurt you. COVID-19 vaccines and tests. Original Medicare Part B covers COVID-19, but I guess it's going to depend on the setting. So we had an individual that mentioned they'd gone to the Sam's pharmacy and then that the pharmacy they didn't cover it. And then Melinda earlier was mentioning that more than often, a lot of them, these are covered at your doctor's office in an office setting. So check with your doctors again. That's where I get mine too. I've gotten my COVID test there at my doctor's office and the insurance company covers it. So look into it, whether you're on original Medicare or whether you're on a Medicare Advantage plan with the prescription drug coverage, okay? Smoking and tobacco use cessation counseling. I just talked about this a little bit. Medicare covers cessation counseling. There's counseling available for you when you smoke and you want to stop. There it is. I've heard some individuals, it takes them a year, 2 years before they finally stop because it's been a kind of elimination of process for them. But again, it just depends what works for you, okay? And finally, again, here is the website, the Medicare.gov website. It says where to find more information. Medicare.gov. If you go to the second tab where it says, which says find health and drug plans, you click on that. Again, the first thing it's going to ask you your zip code. And if there's 2 or more counties with that particular zip code, you're going to have to pick the county that you're in. Then it's going to go in. It's going to ask you, do you have medication? Do you want to enter your medication? I would enter the name, the dosage amount, how often you take it. Okay. And then it's going to ask you about the pharmacy that you use in your area. You're looking for preferred. There's usually in-network and preferred, but preferred is the one that pays more on the cost of your medication. Okay, so check which pharmacies. Some individuals just pick CVS, look at Walgreens and all those other ones, okay? And if you're in a Medicare Advantage plan, like I was talking about earlier, this information is in reference to those plans. During open enrollment, if you're enrolled into a Medicare Advantage plan, and if that plan is not working for you right now with that particular company that you're with, do know that you have until March the 31st to either go back to original Medicare or switch to another Medicare Advantage plan. March the 31st is the deadline, so that's next month. Again, thank you for your time. My name is Simon Manrique. I am a benefits counselor. You can reach me by email or you can call the toll-free number there. There's my direct extension 45687 and it'll get you directly to me. I am on the phone a lot. So if I happen to not answer, I try and answer, but if I don't, leave me a message. We have a policy that we try to get back to individuals within 48 hours to let you know what's And that's it for me.
One of
Sharon?
one of the reasons that I came today was to hear someone face to face.
Sure.
All of these phone calls that you get, all of these texts and everything. In today's world, you don't know what's scam and what's not. I generally just hang up with all of that.
Yeah,
So that's why today is more helpful and questions that you have,
yeah.
you know, so I appreciate it.
Were there any questions in there?
There are not, but let's extend that one more time. For those of you who have joined us online, if you have any questions, please type those in the chat box. We'll be sticking around here for a few more minutes, and Simon would be happy to answer those for you. In person, are there any other questions?
Oh, yeah.
Oh, okay. Right. I'll watch the chat. You-
Go right ahead, go right ahead.
You say keep patience to the end.
There you go.
You mentioned that you need to have 40 necessary credits. If not 40 necessary credits yet. So
Okay, she's asking about the credits that you need to be able to qualify for Part A free, to get it free.
mhm, mhm.
Social Security
Mhm.
has the exact amount of credits that you have. So you'd have to call Social Security. They will tell you exactly what you have.
Oh.
But that's for Part A. In order to get Part A free, you need to have at least 40 credits. Now, if you have less than 40 credits,
Mhm.
depending on how many you have, whether it's I think it's 39 to 20, I don't have access to my computer to get that information, but I know that it's like 500 and something dollars if it's less than 40. If you have less than I think it's less than 20 or 25 credits, it's like $500. If you have like 25 up to 39 credits, it's $248, I believe, right? I'm sorry. But Social Security will know the exact credits that you have.
Mhm.
And once they tell you what you have, then you'll be able to see if Part A is gonna be free, or you're gonna have to pay a
Extra.
monthly premium for Part A. Part B this year, Part B monthly premium is $174.70.
One more time.
Part B,
Mhm.
and that's monthly. It's a monthly
Yeah, how much?
premium.
How much?
$174.70. That's the Part B monthly premium. Yes, ma'am.
So online, Kieran is asking, when can you start signing up for Medicare?
Medicare would like for you to enroll into it. You have 3 months before the month of your birthday. You have the actual month of your birthday, and you have 3 months after the month of your birthday. Whatever day your birthday is on the month, like some individuals say, well, my birthday's on the 15th, so my coverage is gonna start on the 15th. No, your coverage starts on the first day of the month of your birthday is when the coverage starts, when you enroll into Medicare. Individuals can enroll into Medicare at 60, or, 65. Usually, individuals that are under the age of 65, if you have a disability, you may be able to enroll into Medicare if you're under the age of 65, but with a disability. And again, Social Security, Medicare, they will explain what your situation is with them that way on, but usually at 65. And again, individuals sometimes are working and they're working till they're 70, 72. They usually automatically enroll you into Part A, the hospital coverage, which is free if you work the 40 credits. But that's when you can enroll into Medicare. Yeah, actually 7 months. 3 months before the month of your birthday, the actual month of your birthday, and then 3 months after the month of your birthday. Of course, Social Security, Medicare would like for you to try and do it before the month of your birthday. It would make things easier for them. And all you do is call Social Security. Social Security is basically the only ones that can enroll you into Medicare. Plus, you have the option to also do it online if you want, but, again, I always strongly suggest call Social Security. I'm sorry if I think I said Medicare, but no, you call Social Security. Social Security, the one that can enroll you into Medicare. Next question.
You told about permission to look through your medical records. You can give this permission, or you can
It
not give.
depends,
Mhm.
okay? That, when I was talking about that, I was talking about the Medigap policies.
Mhm.
And if you're 65 and you're coming into Medicare, or and you sign into original Medicare with the standalone prescription drug plan, and then you can afford the Medigap policy, you don't need it at that point. Where it comes into, where what they call underwriting comes into effect is if you're 3-4 years down the road and you're already on a Medigap policy and you're gonna switch to a different plan, you're susceptible to underwriting.
Mhm.
You turn 65, you got into original Medicare, you got into the standalone prescription drug plan, but you didn't enroll into the Medigap policy at that time, which is basically your initial enrollment period. And 4 or 5 years down the road, you decide, okay, now I want to roll into a Medicare. Okay, you could probably enroll, but you're going to be susceptible to that underwriting at that time. And in that underwriting, they ask for permission to look at your medical records.
But I can refuse it.
Hmm?
I can refuse it. Like, so they ask for permission.
If you're susceptible to underwriting, no, you can't refuse it. That's part of the process for them to try and figure out if they want to
Okay, so
accept you or
like-
not.
So I don't have choices. Even
that
they
point-
ask permission, but I don't have choices. Say yes or no.
Right, pretty much. Yeah, well, it's gonna be easy. The insurance company is gonna say, okay, you're susceptible to underwriting. We need permission to look at your medical records.
Mhm.
Well, I'd rather you not look at my medical records. Oh, okay, well then, we'd rather not. Sell you one of our plans.
Okay, yeah. Thank you.
Any other questions?
I don't see any online. Anybody else here in person?
So one more question. So Medicare Part A and Part B. A couple of weeks ago, my wife felt dizzy, so we called 911 and she was taken to emergency room. So is Medicare Part A covers there or Medicare Part B covers emergency rooms?
It's well, I don't know what, again, what her condition was or anything like that, okay? So it depends. Was she admitted? Was she not admitted? Was she just went to the emergency room and, was sent home?
Yeah, about half a day later, she was.
Yeah, so I don't have access to the, but we can look at the Medicare.gov website.
You can
I
go.
would suggest maybe he contact us, because we don't want to share any
Okay.
Oh,
Yeah,
personal
you're right.
information.
No,
Yeah,
I would-
yeah.
I would rather you call us and then we can talk one-on-one and you, and then I can tell you exactly what options would have been available for you.
Okay, so the Plano Public Library would like to thank all of you for attending today's Medicare program, and a big thank you to Simon and Melinda for all that you have shared with us. And if anybody needs any library information, know that you're welcome to contact Eric here in person or myself. Also consult the Plano Public Library website for upcoming programs like this that may be of interest to you. So with that,
We have one more question if we
one more
do have.
question. It did just pop up. What is the
Yes,
best way to see if a doctor accepts original Medicare?
Call the doctor's office and ask them. They will
that
tell.
is correct. Yes. And you can go online to Medicare.gov, but that may not be the latest information. So as Simon mentioned, calling the doctor's office is the best way to find out if they accept original Medicare and if they accept assignment. Thank you all.
Thank you.
Thank you.
Thank you. Y'all have a good one. Be safe out there. Bye-bye.
Bye-bye. Thank you, Sharon.
You're welcome. Thank you.
Mm-hmm.
Thank y'all for the pens. These are nice.
It was